Racism is bad for your health. In the deeply honest memoir, Are You Really the Doctor by Dr. Matthew Hutchinson, he reflects on training as a doctor and the way racism still affects both medical professionals and patients. This book spans two parts of my life, reading books and my day job. I don't talk about being a doctor much on social media, partly because the regulator is very prescriptive about what doctors can do and say off the clock, which is a sentiment I feel Dr. Hutchinson shares. But it's important to talk about privilege, prejudice, and how these affect the practice of medicine. Dr. Hutchinson is of mixed Caribbean heritage, and as such, he admits that it's exasperating trying to overcome some people's stereotypes of what a doctor looks like. The expression, "trust me, I'm a doctor," comes a lot less easily if you have to spend extra energy even convincing the indignant patient in front of you that you are one. Many people still have a fixed picture of what a doctor looks like, i.e., a middle-aged white guy. Take, for example, the response to the announcement of a black Doctor Who. If some members of the public can't cope with a time-travelling, shape-shifting alien being black, you can bet they probably have similar thoughts when it comes to brain surgeons. Personally, I've experienced everything from racial microaggressions to straight-up aggression while doing my job. And let me tell you, there's nothing more undermining than knowing that the sick patient in front of you, who you're trying to help with your skills at 3 a.m, can still muster up enough strength to put you down with their prejudice. And the medical profession itself is overwhelmingly middle class and rigidly hierarchical, and any deviation from that, such as a broad regional accent, can mark you out and make your progression more difficult. Whilst I firmly believe doctors do have their patients' best interests at heart, a patient's accent can even affect their healthcare interactions, as he writes in the following. As a patient, how you speak may save your life. Well-spoken native English speakers often get better treatment. Healthcare workers subconsciously aware that the sharpened middle-class elbow is the last thing you want digging into your career. You never know, they could be a lawyer, they might golf with a local MP. You could be one bad consultation away from calamity. Better instead to roll out the red carpet and genuflect appropriately. Another thing he captures very accurately is the medical hierarchy itself and what it's like to be a junior member of such teams. It's a job where you're expected to sometimes make literal life and death decisions while being infantilized as just a junior, which the tabloids seem to be very keen to do right now during the current resident doctor strikes. We live in a world where politicians are rolling back anything to do with diversity and inclusivity, but this knee-jerk reaction causes real harm because race still affects health outcomes. I'd recommend this book, both as a memoir, but also for Dr. Hutchinson's unique contribution.